Hello, love you all so much. You're welcome to my YouTube channel. Yeah, my name is Susie Glow. If it's your first time stopping by, I'm a YouTuber, a Cameroonian based in Boya, that is the chief town of the Southwest region. Yeah, today I'll be doing a product review. Yeah, a product that helped me, helped my family, and it has helped so many people that are going through or who went through very difficult times with toothache. What? At times I don't really like to talk about toothache because when I just pronounce the name toothache, it's as if the toothache is coming right back, and that's a nightmare I never want to go back to. Toothache had worried, had disturbed, had like messed up with my life for some years back. Not really that long, because I know I can, if I remember very well, I had a molar removed in 2016. This is the product I'm talking about. It's finished because I don't play with this product. Can you see this product very well? Can you see this? I really want you to see it. This product is called Eludril. Eludril is the magic and solution to your toothache. Toothache is not a good experience. For those who've never had it, oh, thank God, because the pain you feel when you have toothache, it's really unbearable. Like seriously, as I was saying, I am a lover of sweet things, and sweet is not very good for our teeth. Too much sweet things, a lot of cold water are not the best friends to our teeth. They really get to destroy them. So what Eludril does, Eludril is an antiseptic mouthwash. What is antiseptic? Antiseptic is any solution that fights bacteria, prevents their growth, reduces their multiplication, and kills them. That's what Eludril does. And what happens when you have toothache? Toothache comes about as the fact that when you eat a lot of sugar, the sugar now and the sugar combines with the bacteria, and the bacteria in your mouth, because our normal flora, like the normal oral cavity is made up of bacteria. What happens, but they are all commensals. Commensals means they live with us 50-50, which means our antibodies, our white blood cells, fight them, and they also fight back. So they are in an equilibrium. It means nobody is overshadowing another. So it's a war whereby it's 50-50. Everybody has the strength, so they are okay in the mouth. Now, what happens is that when you take in a lot of sugar now combines with that bacteria in your mouth and produces an acid. It's the acid that destroys the enamel of the teeth. And when it starts, you start discovering that you start having brittle teeth. Your teeth starts falling, that it starts breaking. You discover that at times in your mouth you feel like something like stone. It starts giving way, and you feel like particles of your teeth are like coming out. That's what happens, because the enamel is the whitish part of the teeth, and when the bacteria starts, the acid starts working on the enamel. Enamel does not need an acidic medium. So when the mouth becomes acidic due to the fact that bacteria and sugar have come together and produce that acid that is very harsh, that is destroying the enamel, we start having what we call toothache. That's what we also call dental caries. Dental caries is very painful. It eats deep into the enamel such that it gets to the nerves of the teeth. And when it gets to the nerves of the teeth, that's when you start having that serious toothache. Toothache is not good, because when you have toothache, in fact, I've been there. That's why I talk. I talk because, like, talking from experience, as I can say, I've been through that part, and it's not a good part. What happened is like every part of your head is falling off. You think that the whole world is coming to an end. Like you feel this severe headache because the nerves are connected. You can't at times even open your mouth to speak because when air gets into your mouth, it's as if it's aggravating the pain. The worst is chewing. You can't chew because when any particle of food goes into that tooth that has a hole, it makes the process of pain worse. The worst is when you drink water. Oh my. When you drink water, it's as if the whole head is falling apart. Like before I got the second molar removed, it was so bad that I was almost like thinking something different was about to happen to me. Yeah, it was so painful, and the dentist said there was nothing he could do. It was just for him to remove the tooth. There were days I could not even eat because the pain was too much. Imagine chewing, and mine was worse because it's usually the molar. Excuse me, guys. It's usually the molar that gets infected. Yeah. Toothache. I can talk about it over and over because I hate somebody going through it. And there's something peculiar about toothache. If you've noticed or you've been there before, you discover that during the day you feel much better. There is so much relief. You can go about your basic activities. But when it gets to night, I don't know what pain has with night. It's like they are two very, very close friends. Because when it gets to night, you don't sleep. When people are sleeping, like you're there, you like the night watch, it's very, very annoying. There are days when somebody talks to me, I can't even open my mouth to talk, and everything around me is very boring. People are happy, and it's like, why should they be happy? Because I am not feeling okay. I'm in severe pain. And I would like to talk about how I got to know about Eludril. Eludril. My Eludril. I'll show you this product over and over. Sincerely, the laboratory that created or produced this product, Pierre Fabre. Yeah, the name is Pierre Fabre. It's located in Abel. Yeah, it's a French product, Eludril. Eludril. Eludril is a French product. I got it in Cameroon at the price of, I guess, 3,500, approximately 4,000 francs. Yeah, that's pretty much cheap because I've been on medications for so long. All pain medications, most of them I know because of my toothache, and they were not helping because when you take them, it's like it instantly aggravates the pain. It doesn't do anything. But how did I get to know about this wonderful product? It was not in the hospital. No, it's not. It's not the doctor that made me know about this product. Nah, it's a friend. That's why I'm sharing this with you, my lovely family. So you share this video, please, so everybody gets to know about this product. My video is not sponsored by them. I'm just doing this review because it helped me, and I want everybody who is going through it so that we live or we enjoy our 2020 pain-free. Because I know this festive period we've all taken in a lot of sugar, a lot of cold drinks, a lot of things that are going to harm our teeth, and soon our children are going to start crying. The whole family will be down because their teeth is paining, and you'll be running helter-skelter when the solution is nearby. Yeah, I got this product at the price of about 4,000 from the pharmacy. The friend who told me about this product, I was on my way to the dentist to get the third molar removed. Yeah, the third molar removed. And what happened, it was like she met me on the way and she stopped me, and when I braked, she said, when I stopped, sorry, she said, where am I rushing to, like in that speed? And I told her, please, I don't really have time for us to talk because the jaw was even swollen. I said, please, can we talk later because I'm really not feeling too well. Then she said, what happened to your jaw? Because I guess I'm seeing it swollen. Then I told her, that's my problem. I'm rushing to the dentist to get that tooth removed. Then she said, no. Can you wait? Try something else for about 2 to 3 days. Then you get back to me. If you really need to remove that tooth, try something else. Then she gave me the name of this product. Yeah, I drove directly to the pharmacy and got this product. Guess what? I take a cup of this product like this, the cover. I put full I put the Eludril into it full. I put in like a quarter glass of water, so I can put in like 100 mils of water. Yeah, in 100 mils of water, I put in my mouth. I gargle very well. Let it stay there for about 2 to 3 minutes, and I spit it out. Yeah, and what I also did to accompany this medication and make it work faster is that I started using sodium bicarbonate in brushing my teeth. Yeah, why sodium bicarbonate? Because normally acids are the cause of the dental caries, right? Oh, sorry. Yeah, I started. What I usually do in the morning and in the evening is that I take like a tablespoon of sodium bicarbonate, level spoon, not full. I don't put in water. I just put my brush into it, like I put it in a saucer. I touch my damp brush into it, and I use in brushing my teeth. What happens is that normally acid and base neutralizes, right? So what is causing the dental caries that gives us severe pain is the acid. So sodium bicarbonate is a base. So when you combine sodium bicarbonate and the acid already in the mouth that's causing the dental caries, what happens is that they neutralize each other, and it's a salt and water production which leaves you with less pain. Yeah, Eludril. Now after that, I rinse my mouth. I put a cup of this full in like 100 mils of water, and I put in my mouth. I gargle for about 2 to 3 minutes, and I spit it out. And before it got to the third day, my, I was feeling so good. The pains had gone, and I just imagined how something this cheap could help solve my problem I've had like for years. Please, it's not expensive medications that does the job for us. You could try something out. Listen to what others say, because there's always a story out there. Somebody might have been through the path you're going through. And also advise that we all share experiences. What you're going through, don't hide, especially when you're sick. E-health, you don't hide it because you don't buy in the market, right? So it's good that you share, so that somebody out there might help you as the person helped me. So let this video go viral, please. Please, let this video go viral. Eludril is gonna help you overcome your stress this 2020. Yes, toothache is a bad thing, especially for kids. So to prevent toothache, please avoid giving too much sweet things to your children. I know some of us mothers, we use it as a form of love, to show much love to your kid, but toothache is not a good thing. And when a child starts accumulating sugar in the mouth, what next do you expect? It's just toothache. And imagine you removing a tooth from a teeth of a child who is very young. I am living without 2 molars. Imagine if I had to continue like that. Sorry, I wouldn't say I don't take sweet things anymore. If I say that, I'm lying. I take them, but I just reduce them. And make sure oral hygiene is part of your routine. Let your kids brush their teeth often. You brush your teeth often. Morning and evening is the best you can do, because the food you ate throughout the day staying in your mouth and all of that is promoting bacterial growth and all of that. So Eludril, as I said, is an antiseptic mouthwash. I'll repeat, that stops the production of bacteria, stops its multiplication, and also kills the bacteria that causes dental caries, and dental caries that causes pain and severe toothache. It also helps with mouth odor. We usually call it in the nurse's language halitosis. Mouth odor, it's not good. Many people have mouth odor. They suffer from it without knowing. When they sit in the midst of people, they can't talk. Even when they talk, people are not comfortable. If you have a friend that is going through that, in a polite manner, because it's the way you present your case to somebody that makes the person feel, oh, I have a solution to my problem, or makes the person feel like depressed. Why am I going through all this? Make the person know that others have the same problem and they've had solution to it through this mouthwash. And if you are a very, 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 very kind person and you have the resources here to share, this is 2020, begin this year with a bottle of Eludril to 2 or 3 friends of yours, and you'll see the feedback you have. Many people are suffering from halitosis, that's mouth odor, and also dental caries, that's toothache. I love you all so much. I will bring you guys a lot of health education and health talks on this channel. That's why Susie Glory, it's a makeup artist and a nurse. So at times we'll go the health way and we'll go the beauty way. As the name goes, Susie Glory Health and Beauty Channel. So guys, try this product, please. Before you go to your dentist to get your tooth removed, try this product. Reduce your intake of sugary stuff. Also reduce your intake of cold drinks, water, and all of that, and educate your kids and everybody in the house on oral hygiene. Thanks so much for watching this video. Can you see this product again? Eludril. Eludril is the secret to all our dental problems. It also helps to brighten your teeth. Thank you so much for watching, for your patience. Until my next video, I love you all so much, and stay connected to this amazing channel. Happy New Year! Happy New Year! I'm flexing, I'm relaxing. But when I had toothache, if you speak to me at times, I mean, because I not just want air to get into my mouth. But enjoy your meat, enjoy your chicken, eat the bones because of the calcium in it, and enjoy because you have strong and healthy teeth due to Eludril. I love you all so much. This bottle comes, I think, guess it's about 100 cc of this, which can carry you maybe for a week, 2 weeks or so. So it's pretty cheap. Thanks so much, and I love you all very, very much.